Thank you all for joining our session today. My name is Susanna Trost, and I am an ORISE Fellow in the Epidemiology section of the Maternal Mortality Prevention Team. Together with Gyan Chandra, who is our systems lead, we plan to share information about the MMRIA system, changes included in the most recent MMRIA release, as well as plans for system updates in the upcoming year. MMRIA 2.4 was released last Tuesday, April 13th, so all of the changes described in today's presentation have been implemented and should be reflected in your MMRIA system. I'll now turn the meeting over to Gyan.
Hello, everyone. My name is Gyan Chandra. I'm the IT project manager responsible for the Maternal Mortality Review Information Application, or MMRIA, and the Pregnancy Mortality Surveillance System, or PMSS, on Dave's Maternal Mortality Prevention Team. The system team includes myself and technical staff at Peloton, formerly Northrop Grumman, who are tasked with developing, deploying, and supporting the MMRIA system. The IT division of Northrop Grumman was acquired by Peloton earlier this year. Peloton is a premier IT services and defense contractor for the federal government. Together with your subject matter expertise and input as abstractors and analysts, we hope to continue enhancing MMRIA in upcoming years. This presentation is intended for MMRIA users. We use the term MMRIA users broadly to include those users who actually log into MMRIA and also those who don't, but who are interested in the system or who can potentially benefit from its functionality. In this presentation, I hope to reach users in both groups. In this session, I will provide a brief overview of the MMRIA system, summarize updates included in the April 2021 MMRIA release, discuss planned enhancements, including Microsoft Power BI and Vital Records integration into MMRIA, and finally answer any questions you might have. MMRIA is a multi-user web-based data management system designed to collect data needed to facilitate maternal mortality case review. In order to comprehensively review each case of maternal death, maternal mortality review committees must collect detailed medical and non-clinical information on each woman who died in their jurisdiction while pregnant or within 1 year of the end of her pregnancy. MMRIA's 13 abstraction and 1 committee decisions form help MMRC members understand the story of a woman's life and the events leading to her death. Each state, jurisdiction, or entity has its own secure and dedicated instance of MMRIA on central hosting here at CDC. A sample URL is displayed here. MMRIA data is owned exclusively by each jurisdiction. CDC has no access to a jurisdiction's data for analysis purposes unless the jurisdiction specifically grants approval in writing. A limited number of Peloton and CDC technical staff have system access to provide technical assistance to jurisdictions when they report issues, or to run quality assurance programs to assist in the timely identification of data quality problems. CDC hosts a demo site for external users and a test site for internal users. Publicly available MMRC resources are available on review2action.org. MMRIA-specific abstractor and analyst resources are available on a secure SharePoint online site to authorized MMRIA users. Also, users can report issues or request support by emailing the MMRIA organizational mailbox. MMRIA is hosted on a secure CDC cloud services platform called EasyPass. As a cloud service, MMRIA is subject to the full security assessment, authorization, and continuous monitoring as mandated by the FedRAMP program. MMRIA is secure per requirements of the FISMA Act, and data is encrypted to NIST standards. MMRIA software development is strictly controlled by the HHS-mandated Enterprise Performance Lifecycle, or EPLC policy. The EPLC framework provides a rigorous structure for planning, managing, and overseeing IT projects throughout their lifecycle. This ensures that the best government and commercial project management practices have been incorporated into development of the MMRIA application. Each project release must go through pre-designated phases or stages, which consist of activities, responsibilities, and deliverables that are considered best practices for HHS. After each stage, there is a review or gate, which is performed by critical project partners who utilize their subject matter expertise to ensure compliance with applicable policies and procedures. This strictly controlled stage gate process ensures overall project compliance with CDC IT governance standards and complete oversight of the entire process. User access to MMRIA is secured using CDC's Secure Access Management Service or SAMS. SAMS is a web portal that serves as a gateway, allowing authorized external partners access to secure information and computer applications, such as MMRIA operated by CDC. External partners have to go through an identity verification process to gain access to SAMS. HHS or Defense Department staff with AMS accounts can use your secure smart card uh, to access MMRIA via SAMS. MMRIA employs role-based security and is based on the concept of least privilege. This ensures users only have access privileges in MMRIA to perform the assigned tasks. There are currently four roles in MMRIA: jurisdiction administrator, abstractor, analyst, and committee member. Jurisdiction administrators are responsible for creating, maintaining, and deleting user accounts for abstractors, analysts, and committee members in their jurisdiction. Abstractors have read-write access to cases within their jurisdiction. An abstractor has access to PII data and they can export data. Analysts only have read access to cases within their jurisdiction. An analyst also has access to PII data and they can export data as well. Committee members have read access to de-identified cases within their assigned jurisdiction. De-identified cases do not contain any PII data. Over the past year, our major focus has been to move most jurisdictions to central hosting with the goal of reducing administrative burden on state IT departments. Currently, 46 jurisdictions are currently entering data in MMRIA central hosting. Having a majority of jurisdictions on central hosting has allowed us to standardize maternal mortality data collection so it can be used for both jurisdiction-based and national surveillance and for developing evidence-based process and policy recommendations to reduce or prevent maternal mortality. It also allows us to run quality assurance programs to assist in the timely identification of data quality problems. With most jurisdictions' data moved to central hosting, we are now concentrating on additional software development activities to enhance the system by integrating advanced analytic and visualization tools into MMRIA. Here's a look at our software requirements backlog in the Jira project management software where we track all our work. There are 100 or so items related to central hosting, user interface enhancements, improving reports, and more. Yes, this is a very long to-do list, but we now have a strong team to help us to move quickly through the backlog. MMRIA Release 2.4 was deployed last week. Included in this release are nearly 350 changes that impact most MMRIA forms. Over the past year, we have worked hard to completely revamp the MMRIA user interface. Several infrastructure, security, and system enhancements have also been integrated into MMRIA as well. First, I want to share some high-level changes included in this release. With MMRIA Release 2.4, CDC technical staff can now have the ability to upload vital records data into a jurisdiction's instance of MMRIA, which I will describe shortly. We also made changes to various pick list options for selected MMRIA fields and added new fields across most forms, including the home record, the medical transport form, social and environmental profile, and the committee decisions form. The next few slides will provide more details about these changes. We are excited to share that MMRIA 2.4 includes functionality to upload vital records data, including death, birth, and fetal death records into MMRIA. As part of this work, authorized CDC technical staff will be able to import vital records data into MRIA for identified deaths. This feature is available to a limited number of states as we test out the vital records import process. CDC is working with the National Association of Public Health Statistics and Information Systems, or NAPSIS, and 12 states to pilot the receipt of vital records data directly from state vital records offices, followed by pregnancy associated death identification by CDC analysts using the PMSS case identification criteria. Additionally, two jurisdictions are completing their own pregnancy associated death identification and then preparing standardized interjurisdictional exchange, or IJE, files for import into MRIA. During the import process, we perform automated checks to confirm if there's a match for all of the following data elements: mother's first and last name, her date of birth and death, along with reporting state and state of death record. If there is an exact match, the case is not imported. Otherwise, the case is securely uploaded into a jurisdiction's instance of MRIA. Once a case is imported, abstractors can then update the applicable record with additional information. New fields related to the vitals import have been added to MRIA. These fields are expected to be blank for non-pilot states. We have primarily made changes to the home record, death certificate, and to the infant and fetal death certificate forms in MRIA to facilitate the vitals import process. As this pilot project progresses, we will continue to share information and opportunities to get involved with you all. We hope to make the vitals import functionality available to a wider range of states later in the year or early next year, and we'll keep you updated on that. We have also added all these new fields and updated pick list values to the applicable MRIA SAS import and data analysis programs. Now I want to highlight a few of the pick list changes made to existing MRIA fields. For most single select pick lists, like the ones displayed, blank, which used to be the first option, has been replaced with select value. Most pick lists that had a not specified option have now been replaced with an unknown option. Additionally, an other specified text box has been added to all fields with an other option. For multi-select pick lists such as the mother's or father's race, the blank option has been removed. Also, the none and unknown options have been made mutually exclusive to prevent accidental selection of a valid pick list option along with the none or unknown options. In order to aid faster searching, most repeated forms and grids are now automatically sorted in reverse chronological date order, with the most recent date being displayed first. Also, instead of having to click on the OMB race recode button after specifying the various race multi-select picklist options, now the race recoding is done automatically as users make various picklist selections. On the line listing summary page, to delete a case, abstractors can now click the delete button displayed next to a case. This displays a confirmation dialog box, and abstractors must click the delete button in the message box to actually delete the case. Adding cases in MRIA has been revised. Now, when an abstractor clicks the Add New Case button on the line listing summary page, they are redirected to a new pop-up form where the abstractor must specify the mother's first, middle, and last name, her date of death, and the state of death record. When the abstractor clicks the Generate Record ID button, a confirmation dialog box is displayed. When the abstractor clicks OK, a unique MRIA record ID number is generated. Please note that since the year of mother's death is now used in generating the MRIA record ID number, with this MRIA release, the year of death on the MRIA home record is now being converted to a read-only field, and no edits are permitted to either the year of death or the MRIA record ID number on the home record form. On the home record form, we have also added two new fields to document the abstractor's overall assessment of timing of death in relation to pregnancy. The first question allows the abstractor to assign a category for timing of death that aligns with the death certificate pregnancy checkbox. The second field lets the abstractor enter the number of days between the end of pregnancy and death if it is known. Thank you to everyone who provided feedback about how timing of death is captured in MMRIA, and we hope these new fields help to fill in some of the identified gaps. On the medical transport form, address data fields have been added for the origin and destination of the medical transport. Abstractors can geocode these addresses by clicking on the applicable button on the medical transport form. There is also a button to calculate the distance between the origin and destination of the mother's medical transport. There are also a few changes I want to highlight on the social and environmental profile form. The homelessness, unstable housing, and was decedent ever incarcerated questions used to be single select pick lists. Now they have been converted to multi-select pick lists, and all historical data has been migrated to applicable checkboxes. This change allows abstractors to capture responses at different time points during and after pregnancy. For example, a decedent may have been incarcerated more than 1 year prior to pregnancy as well as during pregnancy. It is now possible to record this information in MMRIA. We have also added a new arrest history grid on the social and environmental profile form. Similar to the question, was decedent ever incarcerated? There is a new multi-select question, was the decedent ever arrested? Following this question is a grid with additional questions pertaining to the date of arrest, the reason for arrest, and when was the decedent arrested in relation to pregnancy. This allows abstractors to capture arrests that may not have resulted in incarceration, which could be an important consideration during analysis. The pick list options for the committee determination of primary and secondary underlying causes of death has been updated to match the printed version of the updated committee decisions form, including new PMSS codes for COVID-19. Obsolete pick list options have been grayed out, preventing their selection in MMRIA during data entry. Also, the overall cause of death categories such as hemorrhage or infection are no longer selectable to encourage committees to determine a specific cause of death. Julie Zaharatos sent out the updated committee decisions form last week, and we encourage you to use this version of the form during your next MMRC meeting. 3 new underlying causes of death codes have been added to the committee decisions form under infection. These include codes for influenza, COVID-19, and pneumonia. Also, 4 additional codes for mental health have been added, including anxiety disorder, bipolar disorder, psychotic disorder, and substance use disorder. We have also updated the SAS programs for importing and recoding MMRIA variables to account for these new underlying causes of death codes. We have documented all form and data field changes made to the MMRIA system in an Excel file posted on the MMRIA documentation site. To access this spreadsheet as well as updated SAS import and analysis programs, please download the zipped file corresponding to MMRIA version 2.4 in the Analyst Resources section. Presentation slides and recordings of past abstract and analyst hours are also available on the MMRIA documentation site. This includes the special April 2021 Analyst Office Hours session in which Susanna covered changes to the SAS import and analysis programs that should now be used to process MMRIA data. Revised blank and coded MMRIA forms are available in the data dictionary section. These PDFs are primarily designed as a reference tool for abstractors and analysts. The coded MMRIA forms PDF displays questions asked on each MMRIA form along with coded and display values for various pick lists. In the updated PDF, newly added questions are highlighted in red. Questions that have updated labels or pick list values are highlighted in blue. Finally, MMRIA release notes along with known system issues and workarounds, if any, are available in the MMRIA section of the MMRIA documentation site as well. In addition to changes made within the MMRIA system, we are very excited to share a new process for importing MMRIA data into SAS. With this change, all steps in the import process can now be completed by running a single SAS program. This includes updating the CSV files for import into SAS and assigning SAS formats and labels. Because the CSV files are cleaned and updated to remove embedded line endings, MMRIA analysts will no longer need to run the CSV to Excel VBA converter. The new main SAS program automatically calls 3 additional support programs to prepare and import MMRIA data. Hopefully, this process will be more straightforward for you all. Here are some of our activities planned for the upcoming year. We are working to completely revamp the MMRIA user interface, extend automated import of vital records, improve searching, reporting, and data export, integrate Power BI to visualize data, and enhance data quality checking in MMRIA. We are adding functionality to enhance search on the line listing summary page in 2 phases. Initially, users will be able to search for values in specific data fields and then display matching records that can be subsequently viewed. Similarly, we are working on enhancing the MMRIA export feature to export only those cases that match a specific search criteria. In later phases, we plan to add and build additional enhanced search and export web pages to facilitate more targeted searching and data exports by power users. CDC is working with selected pilot states to automate the import of vital records into MMRIA. Through the NAFSA's DRH pilot, vital record offices in several states are sharing vital records directly with CDC. After performing case identification, selected cases are being imported by CDC staff directly into a jurisdiction's MMRIA instance. Please note that with this initial vital records import implementation, only new cases are imported into MMRIA. Existing cases are not updated. During the import process, we determine a case is new if there is no match on the mother's name, date of birth, date of death, and state of death record. We are investigating if it is feasible and practical to update MMRIA records when we receive updates from vital record offices at periodic intervals. We are planning to add advanced data visualization capability within MMRIA to visualize key variables. We are planning to automatically summarize the display and display the total number of deaths by various stratifiers such as age group, race, ethnicity, primary underlying cause of death, timing of death in relation to pregnancy, whether the death was determined to be preventable, cases where obesity, mental health, or substance use contributed to death, and other stratifiers such as homelessness status, incarceration history status, and so on. In the in the future, we plan to utilize Power BI more extensively to simplify reporting and data visualization of core MMRIA variables. And we plan to enhance the print version of forms to closely match the electronic data collection forms. In order to improve data quality, we plan to add advanced logic checks to flag inconsistent data between data collection forms and among related data fields. We also plan to make data quality summary reports available to jurisdictions that track changes in key data quality indicators. We are also working on adding audit trail functionality to view when changes are made to various data fields. In addition to maintenance releases, we have 3 upgrades planned for the remainder of the year. User interface enhancements will continue to be added in all 3 upgrades. As part of CDC IT modernization, MMRIA infrastructure is moving from Amazon Web Services or AWS to the Microsoft Secure Government IT Cloud in the Azure platform later this quarter. This includes servers, storage, and firewall software. Our engineers are working to make this transition as smooth as possible. In June 2021, we plan to bring the aggregate visualizations online along with phase one of the search and export enhancements. In September 2021, we plan to utilize Power BI more extensively to simplify reporting and data visualization of additional MRIA variables. We also plan to enhance reporting and graphing available within MRIA in the September release. And by December 2021, we plan to expand the framework for vital records data import, automatically recalculate MRIA calculated fields, and add additional data validation checking during data entry in MRIA. Several CDC staff have worked tirelessly on the MRIA project for many years. Since July 2019, technical staff from Peraton have been assisting us in speeding up the pace of our work. We are excited to have their expertise as part of our team. This concludes my presentation. Please feel free to contact me if you have any questions, comments, or need MRIA support. And now Susanna and I will take questions.
Great. Thank you so much, Gyan, for that really great overview. And we are very excited for all of these updates to the MMRIA system. And we hope that you are also excited and that these changes will really help to improve your review process, the abstraction process, and the analysis of the MMRIA data. We do have a few questions that are coming in through the chat, so I'll start with those, and then please add additional questions if you have any. Let's see. So the first question we received is, are the analysts at the CDC or do they include staff in various states? And so I think that's probably referring to the analyst role within MMRIA. And so that role can be assigned at the state level. So it would be anyone within your MMR program who serves as the epidemiologist or the analyst for your MMR data. That role can be assigned. And Gyan, do you want to maybe explain a little bit about the process if any states want to update their roles or assign someone to a role?
Yeah, usually the state contact will email me saying that a new user has joined or an existing user needs to be in a different MMRIA role. If it's a new user, I end up generating a SAMS invitation and also adding the user to the MMRIA jurisdiction page. Each state also has jurisdiction administrators. User and pick the role analyst, and that will give the when a user is added as an analyst, they see a new panel in MMRIA, and when they click on that link in that panel, they'll have read-only access to the data they are looking at, and they also will have the ability to export data.
And one note about the analyst role too that may be helpful as you're trying to decide how to assign these roles is that the analyst is not able to actually edit the data within MMRIA. And so I know in a few jurisdictions, it's actually the analyst that goes in and enters some of the committee decisions or recommendations and things like that. So if the epi or analyst within your MMR program is the one entering that data, it would probably be best for them to be assigned actually the abstractor role so that they can go in and enter those committee decisions. A related question we received is, can a jurisdiction administrator also delete a case?
Yes, actually, in the previous release, all jurisdiction administrators have to be a member of the abstractor role. And as part of the abstractor role, the jurisdiction admin will be able to delete a case. Yeah.
And then another question we have is, are the ICD codes for substance use under mental health? Yes, they have been added within the hundreds, which is the mental health underlying causes of death. So that is where you would select it. And then if the analyst was doing like grouping some of the causes of death, they would then get grouped within that larger mental health category. And Julie Zaharados also sent out a revised decision tree for assigning the underlying causes of death for suicide and overdose deaths. And that decision tree has been updated to incorporate the new ICD or the new underlying cause of death codes, including substance use disorder. And the next question is, does the analyst review the cumulative findings of the committee? And so I think just depending on the composition of each MMR program, it may differ a little bit across jurisdictions, but generally the analyst or the EPI within the MMR program is the one responsible for taking all of the findings of the committee, as well as the data that has been abstracted into MMRIA, and then working with that MMRIA data to put out the reports. A lot of states do this annually, or they'll combine a few years, but generally it is the analyst at the state level that is doing reporting, analyzing and reporting on those findings from the MMRC. I'm not seeing any more questions, but feel free to continue. We have a few more minutes to go through some questions, so please put them in the chat box if you have any. And then as just a reminder, you can always reach us by email as well and access the resources that we have available on the MMRIA SharePoint site that Gyan shared as well. I'm just looking at some conversation in the chat box, expanding a little bit on the analyst role at the state level. So they often export the MMRIA data, can generate QI data audit checks, as well as generate the annual reports with the cumulative data over all the years that are in MMRIA. And then we have another question about substance use being considered within the mental health categories. And so to add these new mental health underlying cause of death codes, Julie Zaharados on our team worked with a group of mental health and substance use disorder experts, and they came up, based on their work and their experience, they came up with this list of additional underlying causes to add under mental health conditions, and felt that substance use disorder should specifically be called out within that mental health category. And then just another note is the underlying cause of death codes that are on the committee decisions form and also within the MMRIA system are based on the underlying cause of death codes that we use for the PMSS pregnancy mortality surveillance system. And so they do differ a little bit from ICD-10 codes. They are specific to pregnancy-related causes of death. I'm not seeing any questions right now. I'll continue to monitor for this, but maybe while we have a few minutes, Gyan, if you want to talk about the process, if anyone, as they're working with some of these updates in the MMRIA system, if they notice anything that maybe isn't working correctly, or if they have suggestions, what the best way to share that feedback would be.
Yeah. It is, well, it will be better if you can email the MMRIA support email box, or you can also email me directly. A lot of times we meet internally every couple of weeks to discuss any new requests that have come in and determine which of those changes can be implemented and in which release. And so we have a process internally to determine that. And especially if there are any errors or glitches in the system, the vitals import process is a completely new activity which we added in Maria. And so if there are any issues during the import, we are doing a pilot to determine if there are any glitches in the system. And we have tested it extensively, and we are hoping there won't be any. But if you guys notice any issues, please email me or the Maria support email box. Yeah.
Okay, Gyan, and then another question is, would it be possible in the future for information entered into data fields to be automatically populated into the case summary reports?
That has come up a few times. It requires a little more discussion at our end. Uh, because some of the cases might have repeated visits, like the ER visits and medical office visits, it is a little challenging for us to determine which information to move over to the committee, to the case narrative form. Uh, we can work as a team to figure out what would be a good approach for that. And but thank you for your suggestion, and I'll take it back to the team for further discussion. Yeah.
And there's a great point in the chat box as well as something to consider. Automatically bringing in some of those data fields could also potentially mean including identifiable items. So I think that's a really important consideration, especially when thinking through, if it was possible, which fields would get transferred over, is making sure that it did not include any fields where there could even possibly potentially be any identifiable information.
Yeah.
Okay, and then another question is, we had an issue with lost data when there was when the server was full. Do you routinely know when things like this happen, or can you warn us with an email when Maria will be down?
This is one of the reasons why we are actually moving away from Amazon Web Services. We had a local installation, and now we are actually trying to completely move to Azure, which is in the cloud. And all the resources are supposed to be extensible. So when there is additional server resources needed, like either uh, like storage space or processing capacity, it will automatically be extended in the Microsoft IT cloud. So, and that's one of our major reasons for moving from AWS uh, to the other implementation. And we are hoping that will resolve a lot of our issues which we have kind of our users have experienced. And so I apologize for that, but it has happened on occasion. The other issue was there is a firewall software which CDC has installed, and that is also getting upgraded as part of this IT modernization. We were getting a lot of false positives, and when users were going to save, it was getting flagged as a potential issue with the data. And so that's another reason why we are actually upgrading our entire infrastructure to a better and more secure environment where we'll have fewer of these errors.
We have about 1 minute left. So there's any other questions that you would like us to answer today, feel free to put them in the chat. Otherwise, definitely follow up with us with any emails with questions that you have.
Well, thank you everyone for all your input over the last couple of years. We have been successful in making the system a lot more resilient, hopefully, and functional and added enhanced functionality. And in the next year, we are expecting to add a lot more functionality, which will allow you to visualize and analyze data much quicker. So we are hopeful for the next year, and hope you'll all benefit from all the enhanced functionality in Maria.